Have you ever wondered why the US has both ICD-10-CM and ICD-10-PCS? You might think it's one of those coding details that only matters to rev cycle staff, but it actually has a much broader impact than that. These two code sets influence documentation, reporting, registries, quality measures, analytics, reimbursements, decision support, and a lot of the build decisions that analysts make behind the scenes. So in this video, I want to talk about what the two different code sets really are and how they fit into your work as an IT analyst. Before we jump in, if you're returning, welcome back. And if you're new here, my name is Dre. I've been working in various health IT roles for about 20 years now, and I put out these videos hoping that it will help someone who's early on in their career. Let's start with the bigger picture. ICD stands for the International Classification of Diseases. It is developed and maintained by the World Health Organization, and it exists to support the consistent classification of diseases across member countries. ICD is currently in its 11th revision, but many around the world are still working on ICD-10, and it'll be quite a while before everyone switches over. Member countries use the WHO version for mortality or cause of death reporting. And then for things like interventions, administrative reporting, or reimbursement, they often pair that version with their own national adaptations or with complementary code sets. So in other words, the ICD framework is international, but the version that you might be working with day to day might be very country specific. So let's talk about how ICD is set up in the US. So they do use the WHO base version for mortality or cause of death reporting, but then they also have ICD-10-CM, which stands for clinical modifications, and ICD-10-PCS, which stands for procedure coding system. That means the US didn't just take the base code set and add another layer of granularity onto it. They actually created two separate code sets in addition to that one, and that's where a lot of the confusion comes in. So people hear ICD-10 and they think everyone's talking about the same thing, but in the US you really need to understand whether they're talking about mortality data, diagnosis-related data, or inpatient procedure coding. Let's start with the one that people see most often, which is ICD-10-CM, or clinical modifications. This one is used across all US healthcare settings to classify diseases, conditions, injuries, and other health-related factors. It's maintained by the National Center for Health Statistics, which is part of the Centers for Disease Control and Prevention. Codes can range from 3 to 7 alphanumeric characters, and the increase in character length corresponds to an increase in specificity. From a health IT perspective, ICD-10-CM shows up almost everywhere. It's tied to encounter diagnoses, problem lists, decision reports, referral workflows, claims, abstracting, quality reporting, and registries. In many organizations, it also plays a pretty heavy role in rules and logic. It can be used to determine which order sets are seen, which dashboards patients show up on, what alerts are firing for certain patients, and what clinical pathways are being offered. ICD-10 guidance is published by fiscal year, so the usual update is October 1st. And when that happens, you might have some updates from the vendor. There may be additional files that you need to add. There could be some changes, some retirements, some additions, but really you just want to make sure that all of the correct mapping is still in place and that the logic that was there before the update isn't broken because of a difference in that code set. I'm not saying you need to understand every single change that happens in those updates. What I'm really trying to get at is among the IT staff, you need to understand where that code set is being leveraged and how it's being applied into the rules and logic so you can make sure when those updates occur that none of that is breaking. Okay, now let's look at ICD-10 PCS, which again stands for Procedure Coding System. It's published and maintained by CMS. And unlike ICD-10 CM, which again is applied to all healthcare settings in the US, ICD-10 PCS is meant specifically for procedures that are performed in an inpatient setting. PCS is connected to performance measurement, to reporting and analytics, and to inpatient reimbursements. PCS is also structured a little bit differently. It always has 7 alphanumeric characters, so there's no length variation like there was with ICD-10-CM. And the 7 different characters are all meant to specifically relate to a particular aspect of that procedure. So they're very granular and can sometimes be thought of as quite technical, but they're intentionally designed that way because they are meant to be very specific about the procedures they're reporting on. Now, one important thing to note here is that the US is not unique in that they track procedures. Almost every single country tracks procedures in some way, shape, or form with a code set. What is more unique is that the US created a separate ICD-10 code set specifically for this purpose and that it only applies to inpatient settings. Other countries tend to take the ICD-10 base code set used for mortality. They'll add some additional layering on top of it to create a country-specific version, and then they will pair that with a complementary code set that focuses on intervention classifications. For example, Canada uses ICD-10-CA paired with the Canadian Classification for Interventions, or CCI. Australia uses ICD-10-AM and it's paired with the Australian Classification for Health Interventions, or ACHI. So why does this all matter for health IT work? Well, because these code sets don't just sit in a billing file somewhere. They influence what gets counted, what gets grouped, what gets triggered, what gets reported, and sometimes even what gets noticed. So when build, reporting, and operational teams treat these updates just like a narrow coding change, they can sometimes miss the wider impact that they actually have. So if I were to simplify this down to one practical takeaway, it would be this. You don't need to know every detail about ICD-10 code sets. What you do need to know is what version is being applied in your country, what it is meant to classify, and how it is being leveraged across the builds and workflows in the systems that you support. So I hope this has been helpful and it gives you a little bit of clarity on what those two different versions in the US are, how they're applied, and how they relate to the broader international community. And as always, if you like the kind of information that I'm putting out there, don't forget to like and subscribe. I'm going to see you again next time.